Good morning. We are here for our third session for the live stream of NHIF from NHIF headquarters, that is in community. We are here again for 1 hour, and today we have a new speaker. She's going to introduce herself. My name is Phyllis Nyakiba. I have been your moderator, and let's be around for 1 hour so that we can be able to respond to your question. So Yeda, karibu.
Thank you.
Please introduce yourself so that we can start.
Thank you so much. My name is Yeda Bageni Machake. I go by the title Senior Assistant Manager for Public Education.
So the first question is, assuming someone has lost their job at the end of April, and the contribution was done by the employer on 5th May, when is the next time they're supposed to pay? And what should they do other than pay?
Okay.
Yeah.
All right. Your next contribution should be for the month of June. We usually encourage our members to pay forward with regards to installments of 3 months, 6 months, 9 months, and a year. What you need to do is simply use the pay bill number 200-222, and the account number is your NHI ID card. I repeat, your account number is your identification number, the one on your ID card. Once you pay, you will receive a notification from M-Pesa, and that will be it. What you also need to do is maybe perhaps visit the nearest branch and have your details amended from employment to self-employed.
Okay. Cliff Mungare is asking, why do we have some hospitals saying that they cover only civil servants? So why do they pay NHIF if certain hospitals are only covering civil servants?
Okay. Thank you, Cliff, for that question. What civil servants are enrolled in is called the enhanced cover. What non-civil servants are enrolled in, plus the voluntary contributors, is called National Health Scheme. Now, this is the difference. I am sure majority of you saw a gazetted notice recently on our social platforms with regards to the scheme called the Enhanced Scheme. Enhanced Scheme is a scheme that can be basically is a competitor with the private insurers, the schemes that they have, the policies and group insurances that they have. So what happens is the normal member for the National Health Scheme is able to pay more, a little bit more, on top of the national scheme, on top of the statutory deduction that you make, so that they can be able to enjoy the civil servant services. And this does not only cover civil servants, it can also cover retired politicians and retired members. We have all these groups, and if you get in touch with us, we can actually see whether you can join in another group, perhaps for the retired or any other group as well. Thank you.
You posted that if you have defaulted for a year, you can pay 1,500 to your account and then be activated. She's asking if that is still viable.
Yes, thank you very much for the question. That is very viable. The 1,500 is not a 1 month payment. To be clear, that is a 3 month payment, because the monthly payment is 500 shillings per month. We still encourage members to pay upfront. You can do a 3 month payment, 6 month payment, 9 months, and probably a year, as it fits well with you. Now, please also realize and be informed that the account will not start operating immediately. It can only be valid after 60 days from the date of payment. Remember, 60 days from the date of payment. Thank you.
What is the purpose of NHIF to Kenyans? I think he has never benefited from NHIF. Probably doesn't have someone who has benefited. So now you're selling NHIF. What is the benefit of NHIF to Kenyans?
Thank you very much for that question. Now, we need to realize that NHIF is a social insurance fund. It is not like any other privatized insurer. That implies we go over and beyond what you contribute. It is a pool of resources. The young help the old, the ones who are well help the sick, and etc. Now, NHIF has very many packages, or rather, in quotes, benefits. One of them is outpatient services. We have inpatient services, kidney services, we have oncology services, we have radiology services, that is MRI scan, CT scan, and the rest. We also have surgical services, and we have also ambulance services, as well as, not to forget, we also have rehabilitation services. Now, I usually get question on from members on how to join Supa cover. You don't have to pay anything extra to join Supa cover. What I have just explained to you, the 10 packages, is what Supa cover entails. What NHIF did in the year 2015 is our contributions went up, if you can remember, from 160 to 500 for lutein contributors, and the highest paid from 320 shillings, statutory deduction, to 1700. These new contributions enabled what NHIF was before as only an inpatient provider to actually provide outpatient and the other benefits that I've subscribed a little bit earlier. So those are the benefits that any NHIF member, as long as you're paying either voluntarily at 500 shillings per month or you have a statutory deduction on your payslip, you are entitled to these services. Thank you.
Okay, Godfrey is asking, he wants to update his number to NHIF, his telephone number. So how does he go about that?
Geoffrey, thank you for that question. Please visit any of our outlets countrywide. It can be an NHIF branch, can be the Huduma Center, or a satellite office. That is where this change is effected. Thank you.
So Godfrey, you can also call our toll-free number 0800 720 601, and you can be assisted to change your number. Then someone else is asking, so how do I get my NHIF card? I want to register. So how do I go about it?
Thank you very much, viewer. We have 3 ways to get the NHIF card. One way is to get it through your mobile phone. Please dial *155# or *234#, then follow the instructions. The second mode of registration is through any of our branch offices, Huduma centers, and satellite offices countrywide. The third mode of operation is online. Kindly visit our NHIF website. Just go to Google, type in NHIF, get into the website. We have an online platform and link attached to the website, and through it you can be able to register and be a member. Thank you.
Then someone else is asking, if their child has a notification, how do they bring their child on board to their card as a beneficiary?
Thank you for that question. I would wish to inquire how old the child is, but we accept birth notifications as a registration document for children below 6 months. Above 6 months, as government regulates and government policies, you cannot utilize or use the birth notification at any point of registration. Thank you very much. The only things that a member requires, the documents that a member requires to access services at any contracted NHIF facility countrywide are 1, the NHIF card, 2, the identification card, ID card for the member. In case the spouse is the ill person, then you will need the identification card for the spouse. And for the children, you need their copies of the birth certificates to be able to access services across all contracted NHIF hospitals. Thank you.
Okay, there's a Jared who is asking, you gave us your customer care number, which you never pick, your online assistants. I think they're not able to access us. So kindly give them the various ways of accessing NHIF.
Okay. The best way and the quickest way to access NHIF is through visiting the branches, our branches countrywide, Huduma centers, and our satellite offices. We also have 6 other numbers on our website, which you can also use to get in touch with NHIF. You can get in touch with us through Twitter, our Facebook account, our toll-free number, which is up and active. You can also get in touch with us through our number, USSD number 21101. In case you have any inquiries, kindly text that inquiry to the number 21101.
Okay, thank you, Yeda. There's a Felix Olunga. He's asking how does he change his current preferred facility? How does it change actually? How does it change his facility?
Mr. Olunga, currently the change of facility is closed, but you should be able to communicate very, very soon because the deadline was on 31st. We should be able to communicate very, very soon on when else the window is open. Thank you.
So what are the cases where someone might not be able to access? If they've not chosen a facility. So what are the instances?
Number 1, the first instance is if the child is 21 years and above, we need a letter from school to confirm that this is a student in attendance. Number 2, if the child is special, mentally or physically special, we require a letter from an attending doctor to clarify this child requires cover. And the good news is this child will be covered forever, really, under your card. The third reason would be if a member does not have a birth certificate, then it becomes very difficult for the member to access or the dependent to access any benefits countrywide. Thank you.
Okay, I also want to encourage you members and followers that in case you're not able to access the benefits, you can visit our branches, Huduma centers. You can contact us, don't give up. Just contact us and we will guide you in the right way. Then there is Devil. He's asking, how can I replace my lost card?
Thank you, Devil, for that question. Replacing a card is very easy. Kindly pay 100 shillings through M-Pesa to the pay bill number 200-222, or you can also visit any of the Equity Bank, KCB Bank, countrywide, and National Bank countrywide. Pay 100 shillings, get us the receipt, visit any branch countrywide, satellite office, or Huduma Center. We should be able to replace your card immediately.
Okay. There's David Muya asking, how do I check how much I owe you?
David Muya, we have a platform whose number is 21101. So what you need to do is very, very simple. Kindly go to new text message on your phone, type ID, the prefix ID in capital, put a space, type in your national identification number, and send to 21101. I repeat, 21101. You should get a response immediately. This text is charged 10 shillings. So please use our platform. As well as calling us on our toll-free line and the other lines on our website as well, and visiting any of our branches countrywide. Thank you.
Okay, James Kilonzo is asking, can I register my wife with my to my NHIF card? And what is the procedure?
Yes, you can register your wife to your NHIF card, and the vice versa is also true. Your wife can register you as well. What you need is, number 1, a photocopy of each of your IDs. Number 2, you need your NHIF card to be able to identify you when you visit our offices. Number 3, we need small passport-sized photographs. Make sure they are colored. And we need also a marriage certificate. If a marriage certificate is unavailable, what we require is an affidavit. And this affidavit must be sworn either in court or an advocate. Thank you.
On how to apply for the enhanced card. So probably is the Supa cover and you want to upgrade. So how does he go about it?
Thank you very much for that question. Supa cover is group insurance. So what usually happens is the group supposedly it can be your employer, it can be a chama, it can be an investment circle. The group approaches us with that request, then we get the conversation going. So I don't know which group you belong to, so make sure you contact us on our toll-free line, or you can contact us in any other way that I have indicated a while ago, so that we can commence the process. Okay.
Then someone is talking about change of facility. They're expecting a text. So they're saying they changed and they've not received the text. So please advise them on how to go about it.
I don't know which platform. Thank you for that question. I'm not very sure which platform you utilized when you were changing your facility, but it usually happens. You might not necessarily get a text back, but what you need to do is to confirm whether your hospital was upgraded or updated through the very same process you did when you were registering. You can do this or perhaps through *155# and call us, visit our branches countrywide. Basically, those are the ways you can use to confirm the hospital has been updated. For the persons who are employed, of course, the statutory deduction is automatic, so your contributions will get to us in one way or another. For the self-employed whose contributions, or rather whose arrears are below 12 months, then we will have to top up those arrears and also pay the penalties. The penalties are 250 shillings per month, and the standard contribution for each month of arrear is 500 shillings. Thank you.
Change of facility. Someone is asking, and I think quite a number of people. Other than just changing, what is the period? Yeah, because I think we need to also do a lot of education on change of choice of facility.
Yes.
So change of facility.
Okay.
Procedure and when.
Okay. Now there are two things here. We have change of facility and choice of facility. Choice of facility, you can do it anytime. In case you never chose a facility and indicated it on your account, you can do it anytime. A change of facility is acceptable biannually. The deadline for the last change of facility was 31st, but I understand it has been extended, so you can just as easily change even at this point in time. What you need to do is dial the number *155# and follow the instructions to the end.
Then someone applied for the NHIF card and it's never been ready. So the question is, how do I go about it? I've realized that according to members, the understanding is that if my card has never come out, then I'm not a member. So how do they go about it?
Okay. Now, thank you for the question. Let us cushion first your question by letting you know if you've been paying and you're paid up, your account is okay. And you can check your account by texting the prefix ID, in capital, put a space, then put your ID number, key in your national ID number, and send that text to 21101. With regards to receiving the physical kindly visit any of our branches countrywide. You can visit the satellites or the Huduma centers and you should be able to get your card. Thank you.
Then there's a Joan asking that she has an outpatient facility that is faith-based, and they charge her consultancy fees. So she's asking if that is in order.
Thank you very much for your question. No, consultant fee should be covered comprehensively by NHIF. Kindly visit your nearest branch office, request to speak to either the branch manager or the quality assurance officer. This is a case that we need to attend to individually. Please DM us your contact details as well so that we can take this conversation further. Thank you.
And what happens, Lieda, if a member notices an anomaly in the facility they've chosen? What should they do? Because you can be told to buy medicine and you're not supposed to. So what should they do as a member?
Okay. Dear member, thank you very much for your question. Please note you can contact us anytime through our toll-free number 0800 720 0601. I repeat, 0800 720 601. You can also contact us through our website. We have very many numbers that you can call. You can also contact us through our customer service email as well. You can also contact us through our NHIF outlets countrywide, Huduma centers, and the satellite offices that we have with us. Thank you.
So there is Mirambo. What if I don't get sick? Where is the money I contributed going to?
Thank you, Mirambo. Now, remember what I said when we commenced this discussion. NHIF is a social insurance fund. We do not operate like the private insurance. What this implies is your contribution plus the other person's contribution, which is actually probably 1,700, 150 shillings, 500 shillings. All these contributions are pulled together. Now, let me give an example. For example, if probably this is your first month of contribution, you pay, say, 500 shillings. You go to hospital, you get admitted. Where does all this money come from? Maybe, for example, your admission, the invoiced amount was 300,000. Where do you think that money comes from? So I'll remind you again, NHIF is a social insurance fund. What we do is to pool resources so that we can aid this admission and that admission. The employed persons aid the self-employed persons. The young persons aid the old persons. And the persons who are not ill will aid the persons who have a bigger illness. Thank you very much. What happens is NHIF does not limit on the number of children you have to update on your account. You can update as many children as you can. Please remember, you can only update a child who is under 6 months with a birth notification. You will need a birth certificate to update your account with a child who is over and above 6 months. A child who is between 18 years and 21 years will require an evidence that this child is actually a school-going child. Below 25, the same. Mentally challenged and the special persons in our life, there is no restriction on how long they can actually benefit through their parents' cards. Thank you.
Somebody says that they remitted, I think Tommy, their payment.
Yes.
And they have not received a message that they will receive the payment. So he's given us his idea and he's asking for advice. So how does he use self-help?
Okay. Thank you very much. Either download my NHIF app from Google Store. That is the first option. The second option is to text the number 21101 with this message, ID in capital, the prefix ID in capital. You put a space, you indicate your ID number, your national ID number, and text this information to the number 21101. You should get a response promptly and quickly. Thank you.
There's Choco asking, how many hospitals can I choose? I think he basically is asking if I have a family. How many hospitals can I choose?
Okay, thank you very much for that question. You can choose only one hospital for each and every member of your family. That implies one hospital for you as the principal member, one hospital for the spouse, and one hospital each for the dependents that you have. Basically, one hospital each for your nuclear family setting. Thank you.
Continue engaging us for us to have content to talk to you about NHIM. So thank you for today, and thank you for listening to us.
Thank you very much, dear viewer.
Thank you.